Next, we will have our final presentation today. We'll explore findings from a phase 3 trial comparing adjuvant gemcitabine and capecitabine chemotherapy to gemcitabine alone following pancreatic cancer surgery. Lead author, Dr. John Neoptolemos, is chair of surgery in the Department of Molecular and Clinical Cancer Medicine at the University of Liverpool, and he will be presenting these findings.
Thank you very much for the introduction. Ladies and gentlemen of the press, good afternoon. It's a great pleasure to present these results on behalf of the European Study Group for Pancreas Cancer. This is our 4th major trial. So what about pancreas cancer? Well, more patients are now dying from pancreas cancer than breast cancer in the United States. Globally, there are 338,000 new cases, almost a similar number of deaths. Some progress is being made, and we're beginning to see some clear water now between the number of new cases being diagnosed and the actual number of deaths. So in the United States of America, 53,000 new cases in 2016 from ASCO's own data, and nearly 42,000 deaths. Breast cancer deaths now amount to just under 41,000, so this has moved up to be a really lethal cancer in the scheme of things. These are data from Cancer Research UK in the United Kingdom, and that you can see that even 1 year's survival rate has doubled in the last 30 years, principally in the last few years from the greater use of chemotherapy. And these data include those 40% of patients who don't receive any treatment at all because they present either too advanced or with too much of a poor performance status. The SPAC1 trial showed that if you just did surgery and nothing else, did not give chemotherapy or gave chemoradiotherapy, your chances of living 5 years were 10% or less. SPAC1 established that given 5-fluorouracil, that this jumped up to about 16%, and this was confirmed in SPAC3 in using gemcitabine, with gemcitabine having the lower toxicity of the two. So this was our first step change that took place in the treatment of resected pancreatic cancer. SPAC4 put forward the proposal that combining an oral fluoropyrimidine, in other words, 5-FU is given intravenously, capecitabine can be taken orally, that if we can combine the two, we might get better results. And we calculated that to do this, we would need 722 patients. These were randomized at the Liverpool Cancer Trials Unit as a fairly simple trial design. A chemotherapy was given for 6 months in both arms with 3 months follow-up rate. We opened 92 sites over 6 countries, and we recruited ahead of target. As it turned out, we were asked to declare the results of SPAC4 before we reached the target number of deaths. Looking at the results, first in terms of complications, there were no complications, meaning serious adverse events, between the single arm or the combined arm group of patients. In terms of treatment-related, in other words, chemotherapy-related events, again, globally, there was no difference between the two arms. And this is important given the fact that one arm is combination chemotherapy. The second part of the result shows that the 5-year survival rate increased from 16% with gemcitabine to 29% with surgery plus capecitabine, and this result is statistically significant. In conclusion, adjuvant gemcitabine with capecitabine is the second step change that we can now observe for resected pancreas cancer. So if I take you back to SPAC1, no surgery, no chemotherapy, surgery with no chemotherapy or radiation therapy. This is with chemotherapy using a single agent, and now we have a double agent, and you can see the improvement that's taken place. The toxicity was acceptable and manageable. The 5-year survival rate is now 29%, and this is now the standard of care for resected pancreatic cancer. Thank you.
Thank you, Dr. Neoptolemos. I think for patients with such a difficult disease like pancreatic cancer, we are going to see steps and incremental gains, and this does provide with further statistically significant improvements in survival with a combination therapy that does not add to more toxicity. I think this is important results as well. Congratulations, Dr. Neoptolemos.